Joining us now to speak more about the impact of the COVID-19 pandemic starting to wind down on our children is Jaimie Clayton. She is the president and CEO of Oakland Family Services. Jaimie, thank you for being with us today.
Hi, thanks for having me back again.
Good to have you back. How are you, and how's the team over at Oakland Family Services?
We're doing great. We're starting to roll back on site like everybody else, trying to decide what the new normal is going to look like for ourselves and our clients.
So over the course of the pandemic, the services from Oakland Family Services for individual families and individual children, and of course all the general services of your organization didn't stop. They were just done in a different way. Now that we're starting to come out of the pandemic, many of the restrictions that were in place from the Michigan Department of Health and Human Services due to COVID-19 have been lifted, especially many of them as of yesterday, including the mask mandate. How is that impacting how Oakland Family Services is going to continue its services to families and to children in our local area going forward?
So we're balancing that return, and we're even balancing which part of those restrictions we're still doing. So for example, we're still doing a mask mandate right now, and we have 2 preschools which are transitioning to summer camps that I can talk about a little bit further. But the recommendations are still for kids to indoors, 2 and above, wear masks, because as we know, they cannot get vaccinated. So, but we are transitioning services back on site. As you said, our doors were closed, but our services remained open through the entire pandemic. We did provide both preschools on site and partial virtually. What we're finding is not all of our families are super ready to jump right back into face-to-face services. It's a real personal choice, and it's a slower process. If you think about it, particularly therapy services, for example, those are in smaller offices, face-to-face, sometimes crying. Not everybody's ready to be right in a closed room with their therapist yet. So luckily, we're still able to provide telehealth services, telecounseling services, and we're starting to slowly transition those clients that are ready to come back on location. And if they're not ready, we're still able to provide those via telehealth. Some of our early childhood services, same thing. We do a lot of those in people's homes. It's most effective to do home visiting services. Some people are ready to have us back, and some people want to meet outside, for example, and get their parenting skills and those support services out on the front lawn, and that's fine. We're happy to do that as well. So we're really trying to meet people where they are and still keep both our clients and our staff safe.
Jaimie Clayton with us on the Oakland County MegaCast. She's the president and CEO of Oakland Family Services. And Jaimie, the last time we had you on the show, you mentioned how over the course of the COVID-19 pandemic, one of the greatest concerns of your organization and other organizations that are working particularly for at-home services for children was that they're not being checked up on as regularly because you can't send people out due to the health restrictions that were in place, the precautions that were in place. And now as we're into the summer season and kids are going to be more regularly at home once again, parents are starting to go back out into regular life or even are going to continue to be at home. Now that you're able to go back out, are those regular checks being made again? And how critical of a time is it right now, especially over the summer and coming out of a pandemic with all the stresses that are mounting and being released, to have those checks being made at this time?
Yeah. So just for clarity, we were still doing the foster care and adoption checks, I think you're talking about. So the state still required us to go out virtually during the stay at home, but then we did go. But you're right. What we were talking about was there's about 50% less kids being reported through Child Protective Services for abuse and neglect. And that was really about kids not being in school, not being seen by neighbors in the same way, not going to their pediatrician's offices. And so we are hopeful that now that the restrictions are being lifted. For example, we're flooded with requests for summer camp. Parents can't wait to get their kids back into regular services. And so having 100 kids on site every day, we'll get to really have eyeballs on kids in a different way than we would before. We're not looking to automatically report people to Child Protective Services, but it really is the number one way that you find abuse and neglect in the children in our community is through people close to them, professionals in their lives or neighbors who will find those issues. So we do expect those numbers to start to go back up now that the restrictions are being lifted and the community is kind of returning to a new normal.
How how do you know you need to report a child to CPS? What are some signs that you might notice?
So outwardly, the ones that you would automatically know: bruises, cuts, a child that does not look well, especially if that's frequent. You know, kids get bruises, right? They fall, they hurt themselves. But if you're someone in their lives and you see that often, or if you ask a child about that and they seem hesitant, or it seems like they're thinking about telling you a story, or if they look to the adult that's near them before they tell you what happened, that's often an indicator that they're trying to get an okay from somebody. And then there's a lot of issues just around neglect. Do children look underfed? Are they underweight? Are they not clean? Is their hygiene off? Are they wearing the same clothes you've seen them in? You know, the signs that a family might be struggling. You know, again, I don't believe that anyone wakes up on some day and says, today's a great day to neglect my child or even to abuse my child. It's the societal factors that are going on, the pressures of pandemic, the economic stressors that can often lead to those things, and people are afraid to ask for help. So those are some of the signs you might see in a child or a family that you would report.
Jaimie Clayton joining us here on the Oakland County MegaCast. She is the president and the CEO of Oakland Family Services, and she's with us today on the program. And Jaimie, as we're coming out of the pandemic, and as you said, you're expecting to see a little bit of hopefully just a little bit of an uptick, if any, or ideally no uptick at all, but at the very worst, a little bit of one. But there is a significant uptick in these cases. Is Oakland Family Services and is Child Family Services, even more beyond that, on a more macro level, ready to address that issue? And do they have the staffing and the expertise in place to do that and handle that promptly? Because that could be a major issue.
Yeah, that's a super complicated question.
Right.
So try to stay out of the politics of some of what's happening at the state level around child welfare. It's a pretty politically charged issue right now, how child welfare is managed and funded at the state. Agencies like ours, nonprofit agencies, are funded at different levels than the state agencies. And we think that there's a disparity that's not quite fair for us. But we're going to serve kids no matter what. So we're ready. I do think you're onto something in all of the safety net industries that are not different than the businesses, that there's staffing shortages for sure. We have many open positions. It's a struggle to find professionals right now and to keep them. We are using signing bonuses and retention strategies. We have openings actually in our foster care department, but we also have the staff who are well trained, very well suited to handle cases of abuse and neglect. We've been doing this work for, we're having our 100th anniversary this year. And actually one of the very first services we did was around foster care and caring for children that had neglect and abuse issues. You know, the state is certainly ready and qualified. The state is trying to move upstream. There's some federal legislation and dollars around prevention services and keeping kids out of the foster care system and providing more wraparound services when we find that families need them up front. And I would say those are all a work in progress right now. Some are being piloted on the west side of the state, and some are hit or miss. But whenever we can get it on side before we're at the abuse angle, we're ahead of the game for that child and family. And Oakland Family Services does both of those services, full spectrum.
Jaimie Clayton with us on the Oakland County MegaCast. She's the president and CEO of Oakland Family Services. And Jaimie, you did mention that Oakland Family Services is looking to hire in several different positions. What are some of the openings that are available for people that are looking for a job, and on top of that, looking for a job where they can have a great impact on our local community?
And I'm so glad that you said that, because that's exactly it. If you want to work at a place where you're building brighter futures and you can see every day that you're making change, Oakland Family Services is one of those places. And we are going on, I think it's our 7th year of being a top workplace in the top 100 in Michigan, based on our culture and how hard we work to have our staff feel valued. We have positions in our preschool. We have lead teacher positions, assistant teacher, childcare assistants. We have therapist positions, home-based and outpatient clinician positions. And we have foster care positions, and we have supervisory positions for our preschool as well. And we have a couple positions in our development area as well around fundraising.
Jaimie Clayton with us on the MegaCast. She is the president and CEO of Oakland Family Services. And Jaimie, you had mentioned earlier that your preschool system is currently transitioning into its summer camp program at the moment, and you have some open spaces there. What are some of the programs that are available for families that are looking for something to occupy their child's time over the course of the summer now that things are back to somewhat normal and not virtual all the time?
Yeah, we've got great demand. We have spaces, especially in our Walled Lake program for summer school. And we were very lucky to get a grant through the state. I think people have probably seen there's a lot of American Rescue dollars and state dollars coming through for childcare, preschool, summer camps. So we've been able to discount those prices, but we're not just looking at it as some place for parents to take their kids to spend the time. It's true summer enrichment. We are highly aware that so many of our kids had learning loss for the last 2 years, on top of just regular kind of what we call summer slippage of those skills. So we do a program for K through 12. We do school age kids as well. We're focused this year with that grant program on providing some STEM services and activities with some focus on science and math, but also a whole lot of fun. And prepping right to go back into preschool, where we have openings in the fall as well.
And right now, those programs, for those that maybe are curious and maybe want to dip their toes in to what's going on coming out of this pandemic and getting back to normal, are there programs that are still maybe virtual for over the summer for those families that maybe aren't entirely ready to go right back to a normal situation?
Yeah, our summer camp is not virtual because we have actually gotten the opposite message that around this, parents really, I think, for the preparation of a 100% in-person fall, want kids to start to feel ready for that. So what I could say though is we offer, you could do 2 days, 3 days, or a full week. So if you want to dip your toe in just by having your child back on site a couple of days, we do offer that. But I would also say that we take these safety protocols really seriously. Just because the restrictions were lifted yesterday doesn't mean that we have let go of what we've done at OFS around COVID protocols. So we're still doing health attestations and temperature checks. We're still spacing when necessary. We're still doing the extra cleaning, and we want to keep everybody safe. But we also want to help introduce kids back. Our kids need that social, emotional contact, especially to be ready to go back to school in the fall.
So I know you talked about discounting some of your prices, but what if you're a family that can't at all afford to send your kid to one of these camps or programs, but really wants to? Is there a way they can get further help so they're able to provide those opportunities for their children?
There are some scholarship opportunities. I'm not sure how many we have right now at Oakland Family Services. There are, like I said, some discounts through grants. It's certainly, we would want someone to call so we could walk through that with them and see if there's something we could help them with. But I also think that they could call the local county and find out if there are some other funded programs that they might be able to go to, like through the Y or through churches, that kind of thing.
Jaimie Clayton with us on the Oakland County MegaCast. She's the president and CEO of Oakland Family Services that's celebrating its 100th anniversary, and you got some events that are also coming up soon to help the community join in on celebrating 100 years of Oakland Family Services. Can you give us a little bit of a rundown on what some of those events may be and how people can get involved?
Yeah, we're so excited. I think this pandemic really crystallized for me, that we've been around 100 and making it through that and being able to still provide a safety net for our community. We're going to be here for 100 more, and we really want the community to help celebrate with us. So on July 24th, we're very excited to have our first walk-run event. You can walk 1K or you can run a 5K. It's at Waterford Oaks at 8 a.m. and you can find information on Facebook, Twitter, all of the social media sites, but also on our website, which is www.oaklandfamilyservices.org. And then our big 100th celebration on September 24th at Bloomfield Hills Country Club, we're going to have a 100th gala. So we can get dressed up and really celebrate, I think, not just the 100th, but it might be the first time I'm going to be in a dress in a couple of years, but actually get back out and thank our staff, our donors, our supporters, and get back together and really look not just to the past, but to the next 100 years of continuing to build brighter futures in our community.
Jaimie Clayton with us. She's the president and CEO of Oakland Family Services. Jaimie, just another minute or so with you before we have to say goodbye. Any other information that would be important for our audience to know, or anything else you'd like to say before we say goodbye today?
Sure. Just like I mentioned, I think as people are thinking about summer, they're also thinking about going back to school in the fall. In both Pontiac and Walled Lake, we run a Great Start Readiness preschool program for 4-year-olds, and we do have openings. I would encourage people to give us a call for that. But just also, I heard your prior interview, and I do think that mental health and substance use are things we really want to pay attention to coming out of this pandemic. Everybody's really excited and happy to have the restrictions lifted and kind of, reopen into summer. But let's not forget what we've been through, and let's take care of ourselves and be sure that we're looking out for our neighbors. And Oakland Family Services has a host of services available should somebody need it.
Jaimie, we thank you for joining us on today's show.
Thank you so much for having me.